Hello, this is Marissa Rathbone. Welcome to the Texas Education Agency's presentation of the 2011-2012 State Coordinated School Health Goals, brought to you by Active Life. In June of 2011, the Texas Education Agency partnered with Active Life to bring together over 500 school health leaders from throughout the state to first roll out these coordinated school health goals and then to discuss and share strategies for their implementation. Today's presentation is going to share those state goals, which were developed for all Texas schools, and we are excited to share with you all of those goals today. The goals were developed to advance coordinated school health efforts statewide. To draw our focus to the 8-component model of coordinated school health, we did focus on all areas of the Centers for Disease Control model. However, we did also emphasize the overarching goals, which refer back to state-level policy, requiring that all elementary, middle, and junior high schools have adopted, been trained in, and are implementing an approved coordinated school health program or are in the process of developing or implementing an original district-wide coordinated school health program. In addition to that, all elementary, middle, and junior high schools are required to have campus improvement plans that bring together their goals and objectives for coordinated school health. And in that, we encourage that they utilize data related to fitness assessment and other absence and academic achievement related data to help drive those improvements. So as we review each of the 8 components of the coordinated school health model, you'll note that the individual goals listed under each do not have specific percentiles associated with them. However, on the supporting document that you should have also received with this presentation, you will find that each goal has a specific percentile that we associate for state-level implementation. Where it says 100% for any of the goals, we expect that all of the schools are implementing that policy because it is a state-level requirement or because it is either free or easy to implement. Where you see any percentiles less than that, it's based on how easy it is to implement, how many resources you might have available, or whether or not it's a new or old and existing concept. So, first and foremost, health education. In taking a look at the health education goals for the state, we hope that at the very least, schools are implementing the Texas Essential Knowledge and Skills and then providing content that is evidence-based and within the foundation course curriculum. We also hope that whatever implementation of the health education instruction is supported by weighted data from YRBS as well as through the health education curriculum analysis tool, which is available from the Centers for Disease Control for your use. In looking at the next component of the coordinated school health model, we'll dive into healthy and safe school environment. Under this component, we want to specifically look at, first and foremost, bullying and sexual harassment prevention and intervention policies, which are both required and also in the best interest of students throughout the state. We also have teen dating abuse prevention policies and health and wellness signage throughout the campus that is recommended. The next component we'd like to review is health services, where we would like to emphasize the importance of school nurses being involved in the coordinated school health planning process, as well as ensuring that SHACs recruit and maintain at least one health service representative, and ensure that school nurses and their assistants to the school nurse participate in the required training for safety, including AED, automated external defibrillator training. Mental health and counseling services is also critical to the 8-component model, and we ask here again that school counselors be involved in the coordinated school health program planning process, that they're involved in their school health advisory councils, and that they provide training for school personnel and information to parents on bullying and harassment and prevention and intervention. Campuses should also provide education and information to students on bullying and harassment, and school districts should, if they can, have a peer health education. The next component of the 8-component model we'd like to review is nutrition services and education, where we hope and expect that all school districts will have a policy in place to prevent foods of minimal nutritional value from being used as a reward, and also hope that schools receiving reimbursement for school meals will review their wellness policy annually and integrate nutrition education within their foundation course curriculum. Family and community involvement is particularly important as we move towards a more resource-constrained environment in our school systems. As such, we need to ensure that every single school district has an active SHAC, that it's utilizing data through the School Health Index to evaluate program policy and implementation, that our PTAs and our PTOs, our parents, are supporting schools and have a healthy lifestyle chair, and our business partners also support coordinated school health efforts. In addition to that, we'd like to see that local government entities support coordinated school health efforts, such as the Mayor's Fitness Councils, that schools are sponsoring family health events to bring them together at the school environment, that districts communicate the health-related policies to their parents at the beginning of each school year in any manner possible, and that FitnessGram data is shared with parents and their guardians on an annual basis. Within the physical education and physical activity component, we require that school districts submit fitness assessment data for their students in grades 3 through 12. However, we'd also like to see that they're utilizing their fitness assessment data and other data to seek additional funding to support their programs. School districts should also be implementing a policy that prevents physical activity from being used as a form of punishment, and that all their students are participating in at least 50% of class time in moderate or vigorous physical activity. In elementary school, all students are required to receive 135 minutes of moderate or vigorous physical activity each week. And in grades 6 through 8, a minimum of 4 semesters of moderate or vigorous physical activity for 225 minutes per 2 weeks. Elementary, junior high, and middle schools are required to teach the Texas Essential Knowledge and Skills for Physical Education in all those grades. 100% of their school districts are required to establish a teacher ratio for students no greater than 45:1 in a physical education class. Lastly, the school district should be utilizing the free Centers for Disease Control resource to analyze their physical education curriculum called the Physical Education Curriculum Analysis Tool, or PCAT. And lastly, the last of 8 components, we would like to see that school districts and school personnel are walking the talk through the staff wellness component. We would like to see that campuses have implemented a staff wellness initiative, at least one per school year. These goals were created for you, by people like you who care about kids and want to make an impact in their lives and ensure that they're coming to school healthy, safe, and ready to learn. So we know that it's time to set the course for this school year with these goals as your guide and our resources to support you. It's time, Texas.